went on an airplane, rode an airplane, got to the airport just in time, just got out of the airport in time, in the rental car, got to your meeting on time. That's sort of how I feel about all the prep work coming into this. A couple things I want to mention about the speech today about defined contribution. It's really an excerpt from a larger presentation I made a few weeks ago to a group of HR professionals. And it was the sum total about an hour and 15 or an hour and 20 minutes. So the essence of a defined contribution health plan today, there really isn't time to get into a deep dive about employee benefits, deductibles, co-pays, those kind of things. So that's not really what we're here to talk about today. Defined contribution health plan is more of a strategy. So we'll keep it on a higher level as we go through. And I want to talk about the ramifications for employers who offer the strategy and how it affects employees as well. So really, the defined contribution approach is really an older idea that took hold back in the 1970s or 80s. You saw a lot about defined contribution. It really manifested itself more on the retirement side initially, from defined benefit retirement plans where employees just had dollars available for retirement. It was the advent of 401ks where people had more choice and could contribute. That's the defined contribution methodology. So it's similar to the growth of 401ks. What's different between 1970 and 1980 today is, one, healthcare costs are a lot higher than they were back then. Tremendous burden on employers to figure out what to offer to their employees today. It's difficult for employees to actually have a plan that's affordable, that meets their needs, covers the things they kind of need. So in the post-ACA world, it's very relevant today. And I think maybe the initial way I guess would describe a defined contribution strategy is to tell you a little bit of the story. Every year, the Henschke family piles in the minivan and goes down to Washington, D.C. We take a trip to the Smithsonian Institute, and one of our favorite museums is the Natural History Museum. So they certainly have the big elephant in the middle and all the T-Rexes and those kind of things throughout the building, but quite honestly, our daughters, Abby and Kara, now they're 11 and 8, they like to make their way, but ultimately they're interested in going to see the gems and the diamonds and the Hope Diamond in that part of the museum. So we end up ultimately at the Rock and the Gem store. And we've been doing this for about 4 or 5 years, so it's pretty interesting when you have young children in a big store like that. We say to them, we'll pick out some things that you might want to buy, and we'll buy them for you as parents. So it's pretty daunting, there's so many choices. When they were younger, we would have to guide them through the store and say, listen, you can't have these 4 things, you have to pick between maybe this bag of colored rocks or gems or this bag. And in our minds, as a parent, we said, hey, we're gonna give them $20 to spend. They don't understand the significance when they're younger, but in our minds, we had $20 to spend on each of them. So what we do is guide them and say, well, you can't have 3 of these, it's either this one or that one. As they got older and understood finance, dollars, the value of money, we would say to Abby and Kara, you can go in the whole store, take a look at what you like and what appeals to you, but we're going to give you $20 to spend. So now that they understand monies, they say, well, okay, there's some $5 items, there's some $10 items, $20 items, $200 items. So the whole store has a lot of different items, but they know they have $20 to spend. The next year we went back, our oldest daughter said, well, okay, if you're giving me $20, can I take some of my money, $5 or $10, and buy something for $30? So over time, how they approached their choices evolved. So really in the HR or benefit sense, the defined benefit plan is what most of us have had for many years. Really simple diagram. The employer, their approach is, what they're trying to do is figure out the 1 or 2 plans they can offer their workforce that appeals to the greatest percentage of their employees. And it's difficult for employers to continue to do that. So ultimately, a lot of employers would offer Health Plan A or offer Health Plan B. And when you're only offering 2 plans like that, a lot of employees would hector their employer and say, hey, we need more choice. So basically, the employee choice is, I've got Health Plan B that costs $1. I can buy a more expensive Health Plan A that costs $2. So similar to the Smithsonian example, You know, in the early days, Abby or Parrot had the choice between this bag of rocks, this bag, that bag of rocks. That's defined benefit health insurance strategy. Defined contribution is very different. And let's talk about some of the mechanics here. For the employer, what they're actually doing is not just offering one or two plans anymore. So you'll see you'll have a plan A all the way through plan F. So in the Smithsonian example, plan A could be 20 bucks, it could be 40 bucks, plan B could be 10, plan F could be 5, all different kind of variety of health plans. The employer makes that $20 in our example available to the employee. They can use the $20, so maybe plan C costs $20, plan B costs 30, plan A costs 40, or plan E costs 15, plan F costs 5. So the employee actually has a greater choice now by things that maybe cost more than what the allocation of the employer has that they've given them, or something that's less expensive than that. But ultimately, the employee has more choice. What's changed from the 70s and 80s to now is the technology to support those employee decision-making processes has changed. Not enough time to cover that today. So that's really the difference. The employer, to summarize, is starting to get out of the scenario of having to pick just two plans to offer their workforce. So now with an expanded choice of options, employees have a greater opportunity to pick plans that work for them, as opposed to just being stuck with picking plan A or plan B. And ultimately, you know, the thought here too is that employees are in a better position to understand what's going to work for their individual situation, to know if a plan A works for them or a plan D, versus just having the choice of the one or two. So that's really how it's come full circle in the last 30 or 40 years. It's more of a strategy in terms of the employer says, here are the dollars, go shop, which is really what we see more in a scenario where you're actually buying other things other than health insurance or health benefits. I think the easiest way to remember the essence of a defined contribution strategy is just to think about the Smithsonian example, where you have only one or two, where you have some dollars, you can go out and shop from the whole store. So that's defined contribution and evolution. Thank you.